Hey, it's Dr. Melanie Palm from Artist Skin MD in Solana Beach, California. And today we're going to be talking about a new tox. It's Jeuveau. It's a botulinum toxin A, very similar to some of its competitors, Botox, Dysport, and Xeomin. It comes as a 100-unit vial, and we're going to be injecting it on our lovely model, Mallory. So I've actually brought up several areas of treatment. This is FDA approved for moderate to severe frown lines. So these little angry 11s, I'm going to have you frown for me right now. And Mallory doesn't have terrible ones, so we're actually going to do a little lighter treatment. I'm going to have you relax. One of the tips that I have as I'm teaching toxins is I think it's really important to administer sort of pain gate theory. And that means I end up poking after I've pinched the area that I'm going to inject. And I'm always protecting important structures. So for around the eyes, I'm actually injecting away from that. We want to obviously protect that structure. And Jeuveau is new to us, so it just got FDA approved in February. It is supposed to perform quite similarly to Botox. There was a non-inferiority study done where they performed quite similarly. And so I think time will tell how we use this in clinical practice. Can you raise your forehead muscles up for me? So she's got a lot of frontalis activity. Relax for me. So I'm going to inject lightly a little bit higher. And then just a touch here, just so we don't have a funny crinkle halfway down. A little bit here. We'll continue on the forehead. Tiny little pokes. I'm using a really small gauge needle. This is a 31 gauge needle, and so it is a lot more comfortable, I think, for patients. I think they appreciate that, especially if they're a first time toxin patient or neuromodulator patient. And raise up again for me and relax. We're going to catch this little guy so she doesn't get a Jack Nicholson brow. So no one wants that. Raise up your eyebrows again for me and relax. Little poke here and a dot here. I'm going to finish up with one more dot centrally. And then we're going to work around the eyes next. Can you smile really big for me, Mallory? Good. So I'm going to have you turn towards the camera a little bit so we can actually see that little poke here. This helps a muscle called the orbicularis relax, and the orbicularis normally closes the eye. So if we use it around the crow's feet region, it helps to open up the lateral tail of the eyebrow and soften some of what we call lateral canthal lines, or the little crow's feet around the eyes. Again, hers are not super visible, and I tend to taper the amount of dosing that I'm going to use as I go below kind of her mid eye level, or what we call the lateral canthus. I'm going to do a little dot here again for a brow raise. We'll do a little bit here to soften the central crow's feet, and then I'm just going to taper a little bit softly so she has a nice gradation along this area. And the last area that I frequently treat when we are using neuromodulators in the upper third of the face is the bunny line. So can you scrunch your nose for me? See how strong that muscle is? And when we relax these three, we don't want that showing. So I'm gonna have you scrunch again for me and relax. This is, it's a strong muscle sometimes. So I typically do about 4 units of onobotulinum toxin. I'm gonna use a similar dose of Jeuveau. And we'll sort of evaluate her in about a week and see if we need to do any adjustments. And then frown again for me. Good. And I see a little bit of her inferior procerus activating, so I'm going to put a dot there. And that's it. So again, Jeuveau, it's the 4th approved botulinum toxin on the market. It's a purified 900 kilodalton protein, quite similar to Botox, and we're excited to try it out here in the US. If you have any questions, you can call us at 858-792-7546 or contact us through our website. It's artofskinmd.com.